How is it that some doctors can walk in and consistently demand between $4,000 to $6,000 in a care plan, and other doctors cannot? I think one of the big things, if we were to just boil this down to one question, to one situation, the thing that I think in business, we say a multitude of sales makes up for a multitude of sins. Okay. So how is it that some doctors, and can we just use a spinal decompression case? Okay.
Yeah.
As the example, how is it that some doctors can walk in and consistently demand between $4,000 to $6,000 in a care plan, and other doctors cannot? Maybe they struggle to get $1,000 out of a case value for something like that. How can you go from, if I'm doing the $1,000 to the $1,500 in that example, and consistently get to that $4,000 to $6,000 range? What can I do to make that a reality? Because if you quadruple your income just on that one service center, that'll change the entire business. So walk me through that process.
Well, yeah. So the question was, why do some doctors, specifically with decompression, close at a higher rate than other doctors? Sam, does that sum it up?
Yeah.
Okay.
Higher rates and case values.
Okay. So there's three things that I always see when it comes to decompression care plans. I have some doctors that try to close a $4,000 to $5,000 decompression plan, and the patient has not even been on the decompression machine. And raise your hand if you've done this or you've seen this. This is shocking, where patients will try to educate patients on decompression. You have to put them on the service center, and they have to get educated on what it does. If you bypass that, your closing rate goes down by 60 to 70%. So if you don't do that, that's mandatory. The second thing is talking too much. Doctors over-educate. There's a such thing as over-education. Less is more. And when the patients, when they're coming to the office and you're explaining to them how decompression therapy works, we're basically able to vacuum distract that disc, which creates negative fluid, draws in. Once the patient's nodding and they get it, they've been on it, you're there. You don't need to necessarily go further into a 10-minute explanation of how decompression therapy works. So that's over education. You want to avoid that. And the third thing is, doctors don't train and practice on handling objections. So if someone told me, I want to go home and run this by my spouse, I know exactly what to say. No hesitation, no pause. I go right into it. If someone says to me, well, what does my insurance cover? I know my exact answers, and we train on it with our case managers as well. So if you're gonna present plans, you have to train on the objection handling. Is this going to work for me? I have a vacation coming up. Let me run this by my medical doctor. You have to have your own script, and you have to practice it as well.
What's the most common objection you got?
Oh, I hate this one. Can I get a photocopy and run this by my wife or my husband? Drives me nuts. So I say, Sam, I totally understand. I would do the exact same thing. The only problem with that is when you go home, life happens. You get busy with work, you get busy with kids, you get busy with just life in general. And we find we've actually started this 1 month, 2 months, 3 months go by before the patients make it back because of life. And what happens is when they make it back, their problem's usually worse, and it's harder for us to fix. So forget about the plan we just went over. Then I put it upside down. I said, let's do a week of care. A week of care is 2 chiropractic, 2 decompression therapies, and I do the math right then and there. The cost for that is only $375. It's not the whole plan. It's a week of care, Sam. After that week, Sam, you'll feel better. You'll have more range of motion. You'll have more reality on what we're trying to achieve, but you'll feel better. And after a week, we'll sit down like this. And if you decide you want to continue on, we'll put that $375 towards option A, B, or C, so you still get the full discount overall. Sam, does that sound fair?
Yes, that
okay.
Sounds fair.
Now here's the kicker. There's the 70-30, 90-10 rule. 70% will actually say, yeah, let's do that. It's only a week of care. It's $375. It's not the $3,500. 30% are still going to be, no, let me go home and run this by my husband. Let me go run this by my wife, which is okay. And some of those do make it back. But the 90-10 rule, the 70% that do it, 90% do the whole thing. And the reason is they come in, they feel better, they've had the issue for a year, they're not sleeping well, you've created change, you've created less pain, and they see the energy in the office, the staff, they're like, wow, this is the place to be. And in that 7 days, they'll find a way to pay for it, either financing, or they'll borrow the money, or they'll put it on their card. So this is something you have to practice. It's not, and this is important. If they say, well, let me go home and run this, by my spouse, and you're fidgeting, okay, let's do this. If you do that, you lose. You have to practice this. There should be no hesitation. You should come from purpose and come from your office, your office purpose.
Awesome. That was gold right there. The 70-30-10 is awesome. In sales, we call what you did there a puppy dog close, which is basically the person wants to do it anyway. And then you're just saying, hey, here's an easier solution. Like take the thing home, take it for a spin, take it for a test drive. And, it's almost like it's like the autonomic, nervous system. It just does things without you doing anything. That's like one of those rebuttals that comes out just without them thinking. It's based on their subconscious. They just do it because they didn't really think about it. And this is a way to get out of your own way for them. So that is gold.